Hello everyone, I am Dr. Ataur Rahman Khan, consultant in internal medicine. Today I am going to talk about chest pain. 5% of emergency room visits are due to chest pain across the globe. 3% of chest pain due to cardiac origin is missed. Cardiac origin, chest pain can be divided into two groups, cardiac and non-cardiac groups. 31% of the chest pain is due to coronary artery disease by acute coronary syndrome. 30% is due to GERD, gastroesophageal reflux disease. Remainings are pneumonia, pneumothorax, pleurisy, pericarditis, herpes zoster বা shingles, fibromyalgia, panic attack বা anxiety attack বা major depressive disorder, acute exacerbation বা bipolar disorder. Some of the chest pain may be due to drug abuse such as cocaine. In that case, we can categorize it into a cardiac origin because those who take cocaine 1 hour later, they can have a chest pain due to coronary artery constriction. That is also causes chest pain is not too good. Chest pain due to cardiac origin can be clearly diagnosed and treatment should be started promptly. Non-cardiac origin is also should be ruled out in the emergency room by observation. If needed, patient is admitted to observation or coronary care unit. Chest pain due to cardiac origin is very important. As soon as you feel that is chest pain and you may anticipate a heart attack or you had a previous history of heart attack, then chew 75 or 81 milligram of aspirin or baby aspirin, 6 to 7, then swallow with a glass of water. Do not take enteric coated aspirin because it will take time to dissolve. This aspirin is very life-saving medicine at this moment because it will dissolve the clot and prevent the further clot formation in case there is a clot formation in your coronary artery. Chest pain is very important because if we can diagnose chest pain due to cardiac origin, the time is muscle, door to balloon time is 20 minutes. It means that when you come to the door of the emergency room, you have to be transferred to the cardiac cath lab where interventional cardiologist will insert a catheter with a balloon. The balloon will reach your heart. If there is any blockage in the coronary artery, the interventional cardiologist will immediately inflate the balloon and dissolve the clot. This is called primary coronary percutaneous coronary intervention or PCI. In that circumstances, the interventional cardiologist will place a stent in case you are needed. They will start thrombolysis if they think this is important. Also, they may consider coronary artery bypass surgery if they think it is necessary. In either case, it is imperative that you go to the emergency room right away. Do not drive yourself. You are going to be taken in the emergency room by your friend or ambulance. In the United States, 6% of emergency room visit is due to cardiac origin chest pain. In case of children, 80 to 90% of children complaining of chest pain is due to musculoskeletal injury, strain or sprain or a sports injury. Other causes of chest pain, as I have described, also can be considered there. Diagnostic chest X-ray, ECG or EKG and cardiac enzyme analysis that are necessary to diagnose chest pain due to coronary artery disease or myocardial infarction, or in other words, we say acute coronary syndrome, unstable angina, ST elevation MI, non-ST elevation MI. Basically, there are two kinds of MI. One is severe anterior MI or anteroseptal MI, another is the inferior MI. You must know that chest pain is typical and sometimes it is atypical. In case of diabetes or elderly people or women, the chest pain is there, but there may be nausea, vomiting, and cold sweating, all on a sudden. There are variation in the symptoms, therefore you have to be careful. The pain can be referred to the shoulder or shoulders, neck, jaw, and back of you. Chest pain could be left-sided crushing chest pain like an elephant sitting on the chest, or it may be in the center of the chest or both sides of the chest. Or there could be dyspepsia, nausea and vomiting, or lightheadedness or shortness of breath. Kindly rush yourself to the emergency room to get treatment. Protect a heart attack, stick to diet and exercise, go to your doctor regularly, control your diabetes, hypertension, and all other process that can lead to chest pain and cardiac event. Thank you so much for watching this small video. I will deliver more videos in the days to come. Kindly subscribe my channel. Thank you so much. See you later.